Welcome to week 8 of Strong Lungs, Strong Life. This week we will discuss other effects that smoking has on your body, primarily that scary C word, cancer. An estimated 18% of U.S. adults are cigarette smokers. More than 40 million adults in the United States currently smoke cigarettes. Lung cancer is the leading cause of cancer death among both men and women in the United States. 90% of lung cancer deaths among men and approximately 80% of lung cancer deaths among women are due to smoking. People who smoke are up to 6 times more likely to suffer a heart attack than non-smokers, and the risk increases with the number of cigarettes smoked. Smoking also causes most cases of chronic lung disease. The body is made up of many types of cells. These cells grow and divide in a controlled way to produce more cells as they are needed to keep the body healthy. When cells become old or damaged, they die and are replaced with new cells. If this process goes wrong, the genetic material, DNA, of a cell can become damaged or changed, producing mutations that affect normal cell growth and division. When this happens, cells do not die when they should, and new cells form when the body does not need them. The extra cells may form a mass or tissue called a tumor. Cancer and smoking. Many cancers are now linked to smoking and secondhand smoke. Many carcinogens enter the bloodstream and travel to various organs. Smoke exposes many people to cancer-causing chemicals that affect organs besides the lungs. If no one smoked, 1 in 3 cancer deaths in the United States would not happen. Cigarette composition and smoking habits have changed over the years. Smoking increases the risk of dying from cancer and other diseases in cancer patients and survivors. The risk of all cancer decreases if a person quits smoking. There are several types of cancers that are related to smoking. In the following slides, we will discuss these various malignancies. Of all cancers, head and neck cancer accounts for 3%. However, tobacco use is strongly linked to head and neck cancer, especially in tissues where inhaled tobacco must pass. They are more common in men and individuals over age 50. The 5 types of head and neck cancer are laryngeal and hypopharyngeal cancer, nasal cavity and paranasal sinus cancer, nasopharyngeal cancer, oral and oropharyngeal cancer, and salivary cancer. Signs and symptoms to monitor for are a lump or sore, especially in the mouth, that does not heal, a sore throat that does not go away, difficulty swallowing, a change or hoarseness in the voice. There are 2 main types of esophageal cancer, squamous cell carcinoma and adenocarcinoma. Risk factors include alcohol intake, obesity, drinking lye, which is a corrosive agent found in household cleaners, usually ingested accidentally as a child. According to the American Cancer Society, 30% of esophageal cancer cases are linked to GERD, gastroesophageal reflux disease, and Barrett's esophagus, which is a condition from acid reflux in the lower esophagus. People with this condition are 50 times more likely to develop esophageal cancer. Signs and symptoms of esophageal cancer are unintentional weight loss, pain and/or difficulty swallowing, hoarseness, persistent cough, heartburn, feeling like something is stuck in your throat, and hiccups that cause pain or difficulty swallowing. Lung cancer is the leading cause of cancer death among both men and women in the United States. 90% of lung cancer deaths among men are due to smoking. 80% of lung cancer deaths among women are due to smoking. Signs and symptoms to monitor for include a cough that is persistent, shortness of breath, bloody sputum with a cough, recurrent infections, and chest pain. The incidence of smoking in breast cancer has had mixed results. Based on a study published February 2013 in the Journal of the National Cancer Institute, women have a 61% higher risk of breast cancer in those who began smoking before their first menstrual cycle. 45% higher risk of breast cancer in women who started smoking after their first menstrual cycle, but 11 years or more before having their first child. Signs and symptoms to monitor for breast cancer include palpable breast mass, dimpling of the skin or nipple, skin changes including redness or ulcerations. Breast cancer can be detected with yearly mammograms as well as clinical and self-breast exams. In smokers, nicotine is known to weaken the muscle at the bottom of the esophagus, which is responsible for keeping acids produced in the stomach from flowing back into the esophagus. Acid reflux syndrome is a result of this valve not working properly. Nicotine is also known to displace bile salts from the small intestine into the stomach. This occurrence causes damage to the stomach lining and further weakens the organ's ability to extract carcinogenic toxins from the stomach area. Signs and symptoms of stomach cancer include chronic indigestion, nausea, loss of appetite, discomfort in the stomach area, enlarged lymph nodes, enlarged liver, abdominal bloating, and fluid retention. Smoking is estimated to be responsible for 30% of pancreatic cancer. Additional risk factors include age. Close to 90% of all pancreatic cancers are found in people age 55 or older. Gender. For an unknown reason, men are somewhat more likely to develop pancreatic cancer than women. Obesity, diabetes, chronic pancreatitis, cirrhosis of the liver, and H. pylori infection. Smoking itself does not cause liver cancer, but does dramatically increase the probability in people with risk factors such as obesity, heavy alcohol consumption, and hepatitis B and/or C. Smoking is associated with almost half of the cases in people with liver cancer. Former smokers have a lower risk than current smokers, but both groups have a higher risk than those who never smoked. Colon cancer risk is increased among smokers, presumably due to the transport of carcinogens to the colon from inhaled or swallowed tobacco smoke. It's believed that tobacco increases polyp size. Additional risk factors include age over 50, alcohol intake, inflammatory bowel disease, obesity. Signs and symptoms to monitor for include thin stools, stomach cramping, bright red blood in your stool, unexplained weight loss, fatigue, and feeling like you have to move your bowels, but do not. On average, smokers have a 50% increased risk of developing kidney cancer. The risk increases with the number of cigarettes that you smoke. People who smoke more than 20 cigarettes a day can have up to double the risk of the most common type of kidney cancer, renal cell cancer, compared to non-smokers. Smokers also have up to 3 times the risk of developing cancer of the central area of the kidney, the renal pelvis, compared to non-smokers. Signs and symptoms to monitor for include blood in the urine, either after urination or microscopically, abdominal mass, pain felt on the side or lower back, unintentional weight loss, and fatigue. Nearly half of all bladder cancers are attributed to smoking. Additional risk factors include secondhand smoke exposure, race, Caucasians develop the disease more frequently than other ethnicities, gender, males develop the disease more frequently than females, family history of bladder cancer, a diet that's high in saturated fat, recurrent urinary tract infections, recurrent urinary stones, chronic inflammation of the bladder, and a history of external beam radiation. Signs and symptoms to monitor include blood in the urine, making the urine slightly rusty to deep red, pain during urination, frequent urination or feeling the need to urinate without results, low back pain. Keep in mind these symptoms are not sure signs of bladder cancer. Infections, benign tumors, bladder stones, or other health problems also can cause these same symptoms. Women who smoke are 2 times more likely to develop cervical cancer than women who are non-smokers. Signs and symptoms to monitor for include abnormal vaginal bleeding between periods, after intercourse, or postmenopausal bleeding, unusual vaginal discharge, pelvic pain with intercourse or at other times. Cervical cancer is detectable with routine pap smears. In 2010, the International Association for Cancer Research added ovarian cancer to the list of cancers caused by smoking. Signs and symptoms include frequent bloating, pain in your belly or pelvis, trouble eating or feeling full quickly, urinary problems such as urgent need to urinate or urinating more often than usual, fatigue, indigestion, back pain, pain with intercourse, constipation, menstrual cycle changes. Smoking can double or triple your risk of acute myeloid leukemia, or AML. Signs and symptoms to monitor for include persistent fever and/or chills, persistent fatigue and/or weakness, unintentional weight loss, night sweats, easy bruising, bleeding, and petechiae, change in blood counts. Today we learned about the several types of cancer that can result from smoking. Remember, it's never too late to quit smoking to reduce your cancer risk. Thank you for participating in Week 8 of Strong Lungs, Strong Life Cessation class. I hope to see you for Week 9.